Hey guys, in this video we're gonna talk about the anatomy of the arm and elbow joint. But before we talk about the lower humerus arm muscles and elbow joint, I just wanna mention a small concept that I didn't mention in the axilla, which is the clavipectoral fascia. Now the clavipectoral fascia, you guys, from the name, it's a fascia that is derived from the deep fascia of the neck. It comes down, it envelopes the clavicle, it wraps around it, and it comes down to wrap around the pectoralis minor muscle, and it comes down and it goes back to form the axillary. So it's kind of a supportive structure, and because it's covering important structures here, we need to know that it's first of all filling in the gap between the clavicle and the pectoralis minor, because we don't have structures here. We need also to know that there are some structures that are piercing this fascia because they want to get down there, or they want to come up outside. What would want to go down inside? It's your cephalic vein. We have a vein, superficial vein. It starts all the way from the hand, from the dorsal venous arch of the hand, and we're going to talk about that when we reach the hand. And this vein, it's only one. It's not only one. We have two veins. We have the cephalic and we have the basilic. How can you remember them? The basilic, number B in alphabet, comes first, so this is near to your body, and C comes next, so this is away from your body. So you have the basilic vein, which is a superficial vein. It goes all the way down and it continues in the arm, and then it continues up as axillary vein. All right, but the cephalic comes laterally and it goes superficially all the way in subcutaneous tissue, and it moves all the way, and it's gonna drain the veins from superficial places, and then at the end of the day we want to drain into the axillary vein. So we're gonna pierce that fascia, which is the clavipectoral fascia. We're gonna move between the deltoid and pectoralis major in a groove called deltopectoral groove. Can you guys see the depression? It's basically the place that is between the two muscles. It's gonna be a depression here because the pectoralis major is already ended. This is the outer border of it, and because it's above the deltoid, so we're gonna have here a groove. We call it deltopectoral groove. So it's gonna move between these two. The groove is called deltopectoral groove because it's between the two muscles. But the fascia, because it wraps around the clavicle and pectoralis minor, we call it clavipectoral fascia. So it runs in the groove, the cephalic vein. It's gonna drain from the lateral aspects of your everything down, up, all the way, and then it's gonna move in that groove, and it pierces the clavipectoral fascia to drain into the axillary vein. All right, so one important structure that pierces the fascia is going to be the cephalic vein. Another thing, you guys know that the brachial plexus is a deep structure. All right, so in order for the pectoral branch to reach the structures outside the pectoral, it needs also to come out and pierce the fascia. All right, it's going to move through that fascia. So we will have the pectoral, lateral pectoral nerve. All right, because the lateral pectoral nerve needs to come out from there to supply the muscle, the pectoralis muscle. The last thing that is important, which is also passing through the fascia, it's going to be a pectoral branch of thoracoacromial artery or acromiothoracic artery. Remember guys, the axillary artery, it has branches. One of them was the acromiothoracic. It was from the second part. The acromiothoracic, it has 4 branches. It has deltoid. Can you see? It has deltoid branch. It has acromial branch. It has pectoral branch. All right. So this artery will give you a pectoral branch. So also the pectoral needs to come out from the fascia to supply the pectoral region. All right, so the clavipectoral fascia, that's the important things we need to know about, and these are the important structures that are transmitting through or moving through the fascia or passing through the fascia to reach the pectoral region and to reach the axilla from outside, which is the cephalic vein draining into the axillary vein. All right, so here now we're gonna talk about the muscles of the arm. So the muscles of the arm are, we have anteriorly in the arm, we have anteriorly 3 muscles, and posteriorly we have 1 muscle with 3 heads, and one of the muscles of the anterior compartment is gonna be with 2 heads. Now we have skin, we have subcutaneous tissue, we have deep fascia, because the deep fascia is very important to wrap around the muscles and support them. But because we have that, and because we want to divide the arm into compartments, the deep fascia is gonna send something called intermuscular septum, and that is kind of separation between the different groups. So the deep fascia is gonna send septa, all right, between that will separate the arm into anterior compartment that has the flexors anteriorly, and posterior compartment that has the extensors posteriorly. All right. So what are these muscles? By now, I'm sure you guys know them. We talked about some of them in the previous videos. We have 3 muscles, and the 3 muscles will have the word brachii. All of them actually, because brachium in Latin means arm. So I have a muscle coming from the coracoid process to the brachium, which is your arm, which is the humerus. We call it coracobrachialis. We have a muscle that has 2 heads. We call it biceps brachii. And we have muscle that originates from the brachium, from the humerus, and it goes to the ulnar tuberosity. So we call it the brachialis muscle. We're going to talk about the details as we proceed. And posteriorly, we have the triceps and anconeus. And anconeus, sometimes they mention it with the muscles of the forearm, because the anconeus comes out from the lateral epicondyle of a humerus, and this is the common extensor origin. It gives origin of extensor muscles of the forearm. All right, so that's why anconeus is sometimes mentioned there, but because it's a weak arm extensor, we would mention it and consider it one of the arm muscles. All right, and the triceps, it has 3 heads. It's also triceps brachii, so it has 3 heads, and it is the extensor muscle of the arm. Now, what are the muscles one by one? The first one we have is the biceps. The biceps is the first muscle you would come to see in front of your arm. It has 2 heads. It has a short head and it has a long head. The short head, guys, comes out from the coracoid process. Remember when we talked about the coracoid process and we said that we have 3 muscles attached to it? We have the short head of biceps, we have the coracobrachialis, and the insertion of pectoralis minor. Okay, so this is the short head. It comes out from the coracoid, and then the long head, it gets inside, deep down, and deep down there, and up until it reaches the supraglenoid tubercle. Remember, guys, the scapula. We had the glenoid process. The glenoid, it has a tubercle above and tubercle below. The one above, we call it supraglenoid tubercle, and the one below, we call it infraglenoid tubercle. One of them is attachment of the long head of biceps, and then the long head of triceps will feel jealous, and it's gonna go ahead and attach itself into the infraglenoid tubercle of the scapula. All right, so that way you will remember the origin of the heads. Now, if you look at a cadaver, you will find that you will feel that the short head is a longer head. But actually, this is not true. Yes, what you can see here is this is a longer than that, but because here you can see the tendon of the biceps, it goes all the way to the coracoid. You can see that the biceps short head is originating from the coracoid process, and you can see the whole short head. You can see it as the whole length. But for the long head, because it has an intracapsular course, you cannot see the rest of the long head. That's why you feel it's shorter, but it's not shorter. All right, it runs down and it disappears at this point, and it goes inside the capsule of shoulder joint. It gets inside the shoulder and it attaches itself to the supraglenoid tubercle. Where do they attach themselves? The biceps has two tendons. It has one aponeurotic tendon, we're going to talk about it, that forms the roof of your cubital fossa. It's aponeurotic. Aponeurosis means broad flat tendon. It means that tendon is not a rod-like tendon, it's a flat, and it's a subcutaneous one. It comes in the below the skin. And another tendon, regular tendon, that is attached to the radial tuberosity. All right, so it's attaching to the radial tuberosity. Now, what does the biceps do? Of course, everyone knows it's the elbow flexor. All right, so it causes flexion of the elbow, and it can also do supination. All right, this is the biceps. What is the innervation? All muscles of the anterior compartment of the arm are innervated by the musculocutaneous nerve. Remember, guys, the M letter we had M letter in the brachial plexus. We formed them by union of lateral root and medial roots from the cords. These two together, they made the median, and then from the lateral part, from the lateral cord, we had the lateral limb of the M letter that made my musculocutaneous nerve. Musculocutaneous nerve pierced the coracobrachialis, and it moved between the coracobrachialis and the biceps, and it ran here. Okay, so this nerve supplies all of the muscles of the anterior compartment except the brachialis muscle deep down there. It has extra innervation. All right, so this is about the biceps muscle. Now, what about the coracobrachialis? You guys, the coracobrachialis, if you look at it, you will find that it's coming out of the coracoid process. It's very near to the short head. You feel like they are one muscle, and we try to separate them. And you will find it a small muscle, upper medial part of your arm, and it attaches itself medially above in the humerus. It's a very small muscle, and it runs medially above. All right, so comes out with the short head, and it attaches itself to the upper medial part of the humerus. That's why we call it coracobrachialis, and this is the musculocutaneous nerve, how it runs between the muscles of the anterior compartment, and that's why this is the innervation of the muscles of the anterior compartment of the arm. And why do we call it musculocutaneous? Because it starts as a muscular nerve, because it supplies coracobrachialis, brachialis, and biceps, and it ends here laterally by piercing the deep fascia and coming above and giving sensation in the lateral aspect of the forearm. All right, so that's why we call it musculo and then cutaneous, and we talked about that concept previously. What does it do? Most important thing is the arm flexion, and it can also do adduction. All right, so because this is a muscle coming from the scapula and it goes to the arm, so definitely it's gonna work on your arm itself. It's gonna work on your arm, so it's gonna do flexion and adduction, because you guys can see that it's running medially to your body. So if this muscle contracts, it brings this inflection and adduction. All right. Now, the third muscle we have is the brachialis. If we remove the biceps muscle, you will see a deep muscle that is attached to the humerus in the lower part anteriorly of the humerus. It's basically covering the humerus. This is brachialis, and it comes down and it goes to attach itself into the ulnar tuberosity. All right, so it attaches to ulnar tuberosity. How will you remember that? Remember also because there was a fight between the long head of biceps. It was coming out of supraglenoid tubercle. All right, and there was a fight between the biceps and triceps. One was from the supraglenoid tubercle, the other was from the infraglenoid tubercle. We have another fight here between the biceps insertion and brachialis insertion. The biceps will insert itself into the radial tuberosity, and the brachialis will insert itself into the ulnar tuberosity. All right, so the biceps, because you went to the radial tuberosity, I'm gonna go ahead and attach myself into the ulnar tuberosity, and it's supplied by musculocutaneous nerve. You guys can see that the musculocutaneous nerve coming from the lateral cord, that was the M letter, the lateral limb. Remember the M letter, okay? So that was median, that was musculocutaneous, and that was ulnar. So the lateral limb is my musculocutaneous. So if I can see that fashion here, the M letter, I can see the lateral limb. This is musculocutaneous, piercing the muscles, appearing here between the muscles. So it's gonna supply everything here. And the brachialis is gonna also get extra innervation from the radial nerve. All right. So slide. Now the posterior aspect is having the triceps muscle. The triceps, it has